Education starts from the antenatal class, where pregnant women are enlightened on safe motherhood and how to care for the baby after birth, especially in the area of nutrition.
Make sure the baby is well breastfed. For the first 6 months, exclusive breastfeeding without water. Yes, some people have been asking questions that baby will not be satisfied. Baby will be satisfied. If you put your baby on breast, on the first breast for 15 minutes, the second breast 15 minutes, yes, the baby will be satisfied. And you must eat very well. If you are well fed, you will lactate very well. And we told you the importance of this. It is cheap. It has antibodies that will protect your baby against any infection.
The National Demographic and Health Survey 2008 indicates that the duration of exclusive breastfeeding is slightly higher in urban centers than rural areas. Several other reports, including Save the Children and UNICEF's State of the Child's report, show that exclusive breastfeeding in Nigeria is on a downward trend, and this throws the debate out in the open.
Because of the current economic situation in Nigeria, you find out that a lot of women either they don't breastfeed at all, or they breastfeed just for a few months because they have to rush to meet up with their jobs, with their this and that.
It's reducing because most mothers they don't want to give their baby's breast. They think that their breast is going to fall or something, so they believe giving their baby the tin food that they sell in the chemists all over.
No, it's not reducing because people know that breastfeeding is the best. When you go to general hospital or any other hospital, they used to introduce to you that you have to breastfeed your children very well. Even if you are breastfeeding children, it will tell on them. The way they will grow, the way they will fast in thinking is different from the way people using ordinary food for them.
When you breastfeed for a year, you leave the baby very healthy because when the baby is taking breast, it's not using feeding bottle. You know, so many mothers, they are very careless. They throw the feeding bottle anyhow. They don't wash their feeding bottle, and which cause diarrhea, and it makes the children to stool.
Most mothers are said to be favorably disposed to breastfeeding, but achieving this exclusively for 6 months is the Herculean task.
You can express your breast milk and leave it at room temperature for at least for 6 hours, and nothing will happen to it. And the caregiver can give the milk to the baby while the mother is away at work. You can use a cup and spoon to give the baby, or you can give the baby, especially just place it at the corner of the mouth, and baby will latch onto it naturally. You need to make that effort, you need to make that sacrifice, and you have to be really willing to do it. And hopefully, most working places, they allow the nursing mother to close earlier than others. So, and the woman can return home and breastfeed her baby.
Yes, the woman has to produce the milk, but is this breastfeeding task all for the woman?
You see the same mother at home. She has to do the washing, she has to do the cooking, she has to do the running around, maybe taking some children to school. She's stressed up. So you have to remove these factors that stress the woman up. Get her a helper. Get her a helper so that she'll be able to sleep more, eat well, and have somebody to help her to do the household chores so that she'll be able to lactate properly. Because lactation is not only food, it's a matter of eating well, it's a matter of resting, it's a matter of being psychologically okay, have some support from your husband, and family members.
Aside from the baby having optimal growth and health, a breastfeeding mother also has rewards from nature for her efforts.
A woman that breastfeeds, stands less risk of breast cancer, ovarian cancer, and endometrial cancers. I know that. Even though some women, they say maybe they don't want their breast to fall and things like that. Whether you breastfeed or not, I've seen women who didn't breastfeed. At a particular age, your breast must sag.
To encourage working mothers to breastfeed, governments and private organizations need to incorporate baby-friendly initiatives such as the provision of breastfeeding rooms and creches in workplaces, as it is done in most parts of the world. Yomi Otaigbo reporting for Channels Television News.